Hi everyone, welcome to the Aesthetics and Wellness Podcast. I'm Dr Yusra, your host. Today I have Dr Nichola Conlon with me, and we have talked about all things biohacking, longevity medicine, lifestyle medicine, talking to you about what cellular aging means, what you can do to reverse aging, and what supplements you should be taking now to help improve both your aesthetics and the function of your health, your skin, to slow down aging. Okay, welcome. I am so delighted to have you on my podcast today. This is Dr. Nichola Conlon. She is a scientist, founder of Nushido, a supplement that provides a precursor for NAD+, specialist in cellular aging. And for those of you who've been following me for a while, will know that Dr. Nichola has joined me on one of our Skincare Sundays, and we've also spoken together at the British College of Aesthetic Medicine. So welcome. Tell us a little bit more about you.
Thank you so much for inviting me, Dr. Yusra. As you mentioned, I am a scientist. I specialise in cellular aging. So that is what is actually going on inside our bodies at the cellular level to cause everything that we experience as the aging process on the outside. Mm-hmm. Because what we know is that although we traditionally try and treat aging at the surface level, actually everything's starting in our cells. Yeah. So my background is really trying to understand what is going on inside our cells to actually cause the aging process. And before I founded Nushido, I actually had a job working in drug development, designing drugs to slow aging, which sounds pretty crazy, but we know that age is our biggest risk factor for pretty much every chronic disease that drugs companies are trying to investigate. So there's a whole idea that if we can slow cellular aging even just a little bit, then maybe we can actually reduce our risk of many chronic diseases in one go.
Yeah, we're now more and more looking at age as, or aging as a disease. And not so much that aging is bad, but there are certainly age-related diseases like, for example, Alzheimer's or dementia, even diabetes, cancers. So more and more so in aesthetic medicine, we're looking at regenerative procedures and supplements or ways that we can either slow down, reduce, or even reverse biological age. So tell me about biological age. When we're talking about biological aging, chronological aging, cellular aging, what is it that we mean? What do people mean when they say that?
Yeah, so what people don't realise is that they actually have two ages. You've got your chronological age, which is just the number of years since you've been born, according to your birth certificate. But you've also got your biological age, and this is way more important because your biological age is actually the age or the rate at which your cells are aging on the inside. Yeah. So the really interesting thing is that quite often people's biological age and the chronological age don't quite add up, or they don't quite match.
Correct.
So for example, I don't know, someone could be age 50 chronologically, and then if I was to take a sample of their cells and measure their biological age, they may be more like age 60. Mm-hmm. And that would be bad because it means they're aging faster than they should be. On the flip side, some people have a lower biological age than the chronological age, which would mean that they're aging slower, which would obviously be a good thing. So lots of people, when I talk about this, are often like, oh my goodness, like, do I really want to know what my biological age is? Like, do I want to measure it? Yeah. But for us as scientists, this was really exciting for another reason. Well, two reasons really. The first reason was that because not everyone's biological age and chronological age matched up, what they showed us was that aging is not fixed. Correct. Because for a long time it's been thought that aging was like this programmed thing that you couldn't do anything about, and once the march of time was underway, there was nothing you could do to halt it. But if that was the case and aging was fixed, then everyone's biological age and the chronological age
would match.
They would always be the same. Yeah. And they're not. So that was the first thing. It really proved that actually aging is not programmed, because that was argued for a long time. The second thing is it actually meant that we now have a way to measure aging, because for a long time as well it was said, well, fair enough, all these people trying to slow aging and slow cellular aging, but how do you measure it? Like, how do you prove that you've slowed or stopped aging? Like, you can't just give someone some pills or whatever and wait for them to die. It's like you can't do that. So this was a quite a simple way of actually being able to measure and prove that you were slowing the aging process.
So you're talking about tests like Collagen, Fagron, and epigenetic tests, or?
Yeah, so these tests, which is really exciting, are actually available for consumers. So this is no longer just something that we're doing in the lab as scientists. These are things that you can actually get as a blood test at home. So there are multiple different ways you can measure it. One of them that you mentioned is something called glycanage. This is basically, it takes a blood sample and it looks at your immune cells. And on your immune cells, you have little patterns of different, they're like little sugars if you were to look at them under a microscope, like sugar strands. And in a young person, they'll have a very particular pattern, but as they get older, this pattern will change to like an older pattern. So by looking at the patterns of these sugar molecules, you can basically predict what age that person is. The other tests, or the other familiar ways of doing it, are using a process called epigenetics. So epigenetics is a process whereby different patterns of genes are switched on and off. So actually in every...
It's like gene expression, so to
speak. Like every cell in our body actually has the same set of genes, but a hair cell becomes a hair cell, a skin cell becomes a skin cell, because different genes are switched on and off. Now, a young person will have a very specific pattern of genes switched on, and as they get older, we get something called epigenetic drift, which means it drifts towards a different expression or a different pattern of older genes being switched on. And again, this is something you can measure. So by looking at the patterns of genes, you can measure the epigenetic age in the body of the person.
I really love all this stuff, and I've just done a huge presentation about this specific thing, but in relation to skin aging. And we know that with skin aging, there is intrinsic skin aging, which essentially is aging because of the passage of time. Same as biological aging, if you say, or chronological aging. And then there's also extrinsic aging, which is essentially aging that manifests in the skin secondary to exposure to environmental factors. And we're looking at how we can actually influence those. Can we change the way that our genes are expressed, and can we reverse some of the cellular aging that occurs? And certainly we know that you can with certain topical treatments, like for example retinoic acid. We know that utilizing retinoic acid, known as retinoin or retinoids, will stimulate collagen. But collagen is not just a protein that's important for how we look, it's not just an aesthetic thing, but also it's important for cell differentiation, cell signaling, cell proliferation, migration, wound healing. It's kind of manifests in so many different ways. And the idea that actually we can reverse the biological age is fascinating and so important, because it gives us hope and it gives us power, and it means that there is to some degree an element of control. And I guess this is a good time to talk about biohacking, because if we know that we can reverse skin aging, which is a manifestation of cellular aging, and we know we can reverse that and we can reverse cellular aging, well, the question now is, how do we do that? What biohacks can we do that we know will work? And I know that you also know a lot about this in terms of lifestyle changes, from nutrition to supplementation, but also little things that we can do on a day-to-day basis, like even exercise and walking. We know that walking a mile a day can increase the length of your telomeres, which are the little ends at the end of your DNA that become shorter as we age. And that's directly related to biological age and the manifestations of biological aging, i.e. how we look. So tell me more about that.
Yeah, I think, it's such an exciting time to be involved in anything to do with aging or aging research, because all of the research that is coming out now and the evidence that's appearing shows that for the first time in human history, we really actually can do something about age or aging. And that's never been known before, because we've not really understood the aging process at the cellular level. But now the evidence coming out daily almost proves that this is possible, and it gives us clues about what sort of things we should be doing to try and slow the aging process. And I think the key pieces of evidence that are emerging are that actually everything that we need to slow aging is already in our body. So if you think about it, our cells and our bodies are actually very, very good at keeping us in good shape, shall we say, when we're young. Just look at a child. They can have endless amounts of energy. They can fall over and they can, graze their knee and get up and it's healed really quickly. They can have no sleep at night and still have function amazingly. We can't. So there's some that tells us that we have this innate ability to repair, rejuvenate, have resilience, but for some reason it just starts to get turned down as we get older. So a lot of the underlying causes of aging in our cells are because a lot of these natural pathways and repair processes that we have just seem to not work as well as we get older. But the key thing is they never disappear. They're just not activated. So the concept of biohacking is actually about trying to switch back on those natural pathways and processes that we already have in our bodies. So essentially hacking our own biology to help rejuvenate, repair, and restore cellular health, essentially. And this can be done, through lifestyle practices, through different treatments. There's a whole host of things that can be done when it comes to biohacking, but in an essence, it is literally hacking your own biology.
So if you had to, I know you love cold showers, but if you had to say, and I'm a big believer in walking and the power of exercise, but I think there's so many things that we know that can work against us. So our lifestyle factors will influence how we age, either positively or negatively, like for example, smoking or not sleeping enough or chronic exposure to the sun in terms of cellular age, in terms of collagen breakdown in the skin, or solar elastosis, a breakdown of elastin in the skin. And then we also know in some ways you are what you eat, and some of the things that you eat can enhance our inflammation in our bodies. And actually inflammation is one of the worst things for disease and for aging. So if we can reduce inflammation in our bodies, then that's hugely powerful. And that's one of the things that I do a lot of in the clinic, is talk about how we can reduce inflammation, whether that is incorporating pre and probiotics into our diet, particularly for perimenopausal women, to empowering them to stay away from the bad oils that can actually enhance inflammation. But what are the biohacks, generally speaking, that you would do for yourself and recommend to patients around you or people around you?
So just to backtrack slightly, a lot of people have always believed that aging is genetic. People going, oh, it's my genes. If you age badly, oh, it's my genes. If they look really young for the age, oh, it's the genes. Actually, only 20% is your genes, 80% is your lifestyle.
Love that.
So when you say lifestyle is really important, it absolutely is. So in general terms, anything that you are doing to trigger inflammation, to trigger damage, is going to speed up the aging process, because your repair processes inside are having to work overtime to try and repair this damage. So all the things you've mentioned, which everybody knows are bad for them and we shouldn't do, drinking, smoking, bad diet, things like that, are all going to speed up the aging process. Interestingly, while we do tend to focus on these lifestyle factors as, the biggest risk factor for disease and aging, actually age itself is arguably a bigger concern. So your age is a bigger risk factor for many age-related diseases than all the terrible things that we're told that we shouldn't do.
So you're talking here about chronological age?
Your chronological age. Well, biological age. Actually, biological age is a better indicator of future health than chronological age. So, for example, if you have high blood pressure due to a bad lifestyle, so drinking, smoking, things like that, you are twice as likely to have a heart attack. If you are 80 rather than 40, you are 10 times more likely to have a heart attack. So, and I'm not saying that we should be doing all these bad lifestyle things, but just to put it into perspective, actually putting on years is one of the worst things that you can do for your health, which is why we're so enthusiastic about doing things to try and slow biological age. But so looking at lifestyle factors, one thing that I always talk to about people is this idea of putting your body under a little bit of stress. So that kind of sounds counterintuitive. We're always told stress is bad for us. Now, when it comes to psychological stress, that is bad for us. That is pro-aging. But what I talk about is more physiological stress. So this is the idea of just stressing your cells a little bit to kickstart some repair processes. And two of the most beneficial lifestyle practices, which you've already mentioned, which are exercise and fasting, I think you mentioned. These two things are actually two of the best lifestyle practices to help reverse biological age. And the way they work is they both induce a little bit of stress, energy stress in particular, on our cells. So if you think about it, if you are exercising, you are using up a lot of energy in your cells, or if you are fasting, you are using up energy that's not being replaced. So inside the cells, what happens is a little alarm bell almost goes off saying, oh my goodness, we're using all this energy in our cells and nothing's coming back to replace it. So we need to make sure that our body and our cells survive this period of stress. And the way that they do this is by basically switching on pathways that start to generate energy, that start to generate repair. So essentially switching on all of those beneficial pathways that we already have in our cells that just don't generally get switched on in our modern lives. So if you think about it, most people were sitting quite a lot all day. We're eating constantly. We're told we've got to have our breakfast. We can't possibly survive if we don't have a snack every 2 hours. We're constantly eating.
Totally, like this grazing, it's like a whole societal change into grazing, which actually is probably one of the worst things that you can do from a dental health perspective as well as a physiological health perspective.
Absolutely. And this means that all of these beneficial pathways that could be getting switched on to clear out cellular junk, to recycle damaged parts of our cells, to activate repair, are just not getting switched on. Because
you're talking about autophagy.
Yeah, autophagy. This is the cellular repair processor. So, our cells are sitting there thinking, oh, we're fine. We don't need to switch on repair because we've got loads of energy coming in. We've got excess energy because we're not using any. And they start to be wasteful and damage starts to build up. We start to deplete resources in our cells. So exercise and fasting actually are two things that we've known for a very long time are good for us, but now we really understand why. Like why they're actually working at a cellular level to help reduce our biological age.
Yeah, it's amazing. I mean, I'm a big believer in those lifestyle hacks, so to speak, or longevity medicine. It is longevity medicine ultimately. So I think nutrition being one of them, exercise being another one of them. And then also fasting is huge, particularly for women as they go into the perimenopause. And I think what a lot of women do instead is because during the perimenopause, you've got a reduction in estrogen, a reduction in progesterone, and testosterone is a female hormone too. And so women start to get they're not sleeping well, they've got loss of libido, they are anxious, they are angry, they're irritable, they've got brain fog. And in order to compensate for that, they start to graze a little bit more, thinking, I just need to have a little bit more energy. But actually, you're doing the opposite of what you need to. And what we know is that when your gut health is poor, when your gut microbiome is not healthy, that is actually actively destroying your estradiol, one of the estrogen hormones. And so it's this negative loop or negative cycle. And what I tend to do is try and increase the women who come in to see me, I try and increase the fasting period. Because a lot of them go, I can't possibly fast. And I'm like, okay, let's just talk about when you're eating right now. How can we tiptoe it to the right place? And let's just increase it by an hour so that they have a slightly longer fasting window. And we know that autophagy, when we are detoxifying our cells, so to speak, or getting rid of some of our senescent cells and stimulating wound healing response, happens also when we get into a ketogenic phase, which will happen only after reducing our blood sugar level, managing our insulin output, and therefore you're stimulating that autophagy and getting into that ketogenic phase where you're using an alternative source of fuel rather than sugar. Yeah. So I agree with you also in the fact that stress is not necessarily the demon that we think it is. It's how we manage stress, and it's also how often we are exposed to stress. And I see this as well with a lot of the women that I treat, is particularly again when they get into the perimenopause. And when I'm talking about perimenopause is not just that 1 year around the menopause. People think perimenopause is when I reach 50 and I'm about to go through the menopause, I'm perimenopausal. No, that's not what perimenopause is. Perimenopause is those 10 years before the menopause starts, and that can be even from the tender age of 35. And the hormones start to change. And so they don't have as much energy. They're feeling a little bit more fatigue. And it's a slow and insidious onset. And these little hacks can empower them so much more to thrive, not just survive in their 40s and beyond. So I love that. And I think it's really, really powerful. And I think if people understood how to harness what they put into their bodies and what they expose themselves to, and even mindfulness, for me, I'm really tapping into the power of no. Now, as I'm older, I've got typical rushed woman syndrome where, I'm running 2 clinics, I've got 3 kids, I'm leading 10 clinicians. It's nonstop. but actually you end up surviving on this heightened and constant elevated cortisol, which is actively aging you. So I'm really mindful of that now, and now I'm using the power of no and saying, actually, this is not within my bandwidth. I'm not willing to put myself at risk, and I'm a lot more conscious of my biological age, and I'm waiting for my biological age actually to come through my testing. So it's a test that we've just introduced to the clinic. And I think when people know that, knowledge is power. If you actually know where you stand, then you know what you can do about it. And taking away that degree of, oh, well, it's genetics or it's hopeless, nothing I can do about it, is very important, because it also gives back that sense of control and the ability to take ownership of your health journey.
Yeah.
So I want to talk to you about supplements. What do you think supplements are beneficial? I know that you have made NAD+, the precursor to NAD. Tell me a little bit more about that, or Nishido, which is the supplement that you make.
Yeah, so when I worked in drug development, I was frustrated by a couple of things. First is that it takes a very long time to get all the testing and clinical trials done on supplements to get them to market, which rightly so, they do need that testing, but still it takes about, on average 10 to 15 years for a drug to get on the market, which means that we've got all this incredible science happening, but it's still going to be very long before it's translated into something that can help people. And the other thing was that in my role in drug development, we would send loads of different molecules to the lab to be tested, and then we'd get a big list back, and it would say, okay, these things work really well, these work not so great, these don't work. And quite often, the things at the top that worked really, really well were not drug molecules. They were natural molecules, they were plant molecules, things that could be found in different foods. And drugs companies aren't interested in those because they can't patent them. So commercially, completely get it. You're not going to invest hundreds of millions in something you can't own. But ethically, it was like, wow, these things are just getting ignored. They're getting put in the bin. They're not getting the research they deserve. So this is why I started my company. And at Nichola Laboratories, what we do is look at all those natural molecules, look at all those things that are suitable for supplements, and actually give them the research they deserve. Do the clinical trials on them, do the scientific testing, and then, develop them as products that consumers can actually buy now, but, with the understanding that they have had some good science done on them, because unfortunately the supplement industry does get a bit of backlash because there are quite a lot of things out there that don't work, don't have great testing.
Market, right?
It's not, it is to an extent, but not as regulated as it should be. And believe you and I, when I said I was leaving my very credible job in drug development to start a supplement company, everyone was like, what are you doing? But at the end of the day, what I'd seen is that, your body has no idea what is a drug, what is a supplement, what is a nutrient. When they go into the body, they all have equally as powerful physiological effect. And I've seen molecules that are classified as supplements work better than some of the drugs that we were testing. So I think my opinion of supplements is that they can be very powerful. I think they certainly need to have the right science and testing behind them, but there's no reason why they cannot be as powerful, if not more powerful, than some of the other things that we're traditionally, told in modern medicine to take.
So do we need supplements, or can we just get this all from eating the right foods?
So you can, diet is incredibly important. I always say to everyone, there is no point investing loads of money in supplements if you are not eating a good diet. Food is so important. When we look at biological age, we know that diversity of food, especially different types of plant material, can reverse biological age. There were studies looking at people that ate up 30 different plant material a week, reduce biological age. And this is like, fruit, veg, herbs, spices, like anything that comes from a plant is counted. And this is because of all the amazing phytonutrients and, different type of flavonols, all sorts of things that they contain. Everything, everything like that. So diet's very important. But now, some of the quality of some of the foods that we're not eating is not as good. They don't have the nutrients in that they should do because of intensive farming practices, things like that. And also just some of the active ingredients need to be at a much higher concentration
Yeah, dosage is important, right?
Yeah, than can be traditionally found in foods. So like you've just mentioned, like adaptogens, so things that can be found in mushrooms. You would have to eat a lot of mushrooms to get some of the concentrations of the active ingredients that are required to have the effect that we want them to have. So supplements are a way of concentrating some of those really powerful ingredients that we know are beneficial in foods into a form that's, you know, something that we can easily take and easily incorporate into our lives.
Amazing, fascinating. Okay, cool. So tell me about NAD.
Yeah, so NAD, it's a bit of a buzzword that's come around in the longevity space, and it's certainly something that I've been studying for over a decade now. So basically NAD is, it's a natural molecule. It's found in every cell in our body, and it's involved in, well, over 300 different cellular reactions, but it's most famous for two things. So the first thing is energy production. So in our cells, we have these little energy powerhouses called mitochondria. And inside these mitochondria, we have a pathway that essentially takes the food that we eat and converts it into all the energy that our cells need to function and survive. And NAD is a critical part of this process. So it's very important for energy production. The second thing that NAD is really important for is for repair. So you remember I said that we've got all of these repair processes that are constantly going on in our cells. Well, NAD acts as a fuel for a lot of these repair processes. So we know that if you don't have NAD, repair cannot be switched on. So as a general rule of thumb, if you've got high levels of NAD, you'll have lots of repair and lots of energy production. If you've got low NAD, then you will have less repair and less energy in the cells. Now, the reason that NAD's been so investigated lately is because it's been found to be linked with the aging process. So when we're young, we've got really high levels of NAD in our cells, but as we get older, this declines.
Yeah, quite rapidly.
Yeah, this is a crazy statistic. Yeah. So from birth, our NAD halves every 20 years.
Insane.
So even by the time we're 20, we've lost half the NAD that we had when we were born. By the time we're 40, that amount we had at 20 is halved again. 60, it's halved again, which is quite worrying considering how important it is in your body.
And for wound healing as well, right?
Yeah, for everything. Like it's literally involved in every cellular process. So when we see NAD go down in the cells, what we see is damage, inflammation start to accumulate, less energy. If there's less energy, all the cellular functions and pathways can't operate. And you just see this accumulation of damage, which is resulting in cellular aging, essentially. So scientists sort of said, okay, if we've got this NAD molecule in our cells and it's, you know, has this protective role and it declines with age, then why don't we just not let it decline? Why don't we try to keep levels high, or indeed, you know, top levels up back to youthful levels? So there's been now, you know, to cut a very long story short, thousands of published research papers to show that if you can restore NAD levels, then essentially you can restore cellular health, you can reverse biological age, and the benefits across the whole body are amazing. You know, you name it, NAD seems to help. It helps with cardiovascular function, it helps with DNA repair, it helps with energy production, it helps with neurological conditions. It almost sounds too good to be true, but when you think about it, NAD is in every cell and it's involved in critical processes in those cells. So when it declines, it causes havoc, but equally when you restore it, it has massive benefits across the entire body.
And this has been clinically proven now?
Yeah.
Okay, so talk to me about your supplement, because it's not NAD. Actually, if you look at it, there is no NAD plus in it. It's a precursor, right? And now there's a lot that's come out to market, some regulated, some not regulated. Some people selling IV forms of this molecule. Some are selling treatments where you can pre-inject or inject yourself on a daily basis with it. What's your thoughts on that?
So when we started looking at NAD and realizing this was something that was very beneficial in aging, we started looking at all the things that were out there that were available and started to realize that a lot of them didn't make sense scientifically. So back when it was first discovered, NAD, lots of people were like, okay, we just need to restore it. So how can we restore it? And the first sort of thoughts were, well, we will put some NAD, some pure NAD in a capsule and we'll swallow it. And then hopefully it'll get to where it needs to be in the body. And it was very quickly realized that you couldn't do that because NAD is a really unstable molecule. It just does not survive through the gut. So that idea was very quickly scrapped. Then people said, okay, if we can't take it orally, well, why don't we give an IV infusion? Why don't we inject it? So that gets over the issue of it not being able to go through the gut because it's going straight into the blood or into the space between our cells. But the problem here is that it actually is going into the blood, but it's not going into our cells. And that's really important because NAD performs its function inside of our cells, not in the blood.
So it doesn't go. So it doesn't pass that blood barrier. And is that because it's a large molecule?
Yes. So it doesn't. So if you've got the blood's full of cells. The body's full of cells, and NAD performs its function inside of the cells. That's where the mitochondria are. That's where the DNA is that it repairs. That's where everything happens inside the cells.
So the mitochondria, I always say, like the little batteries in our cells, they provide energy.
Exactly
for those
that.
Who don't know.
Yeah, the little powerhouses. They keep us alive, essentially. But basically, cells don't let things just pass in and out. They're very controlled.
Yeah.
So because NAD is a large molecule, it needs a special door almost to go through our channel.
I love how you've explained that.
Yeah. So it literally, if you were to look at our cells, the membrane around it, like the wall around it, literally has all these different shapes and size doors to let different things in and out. And most of the cells in our body do not have a door to let NAD in. So currently it's only being shown that our neuronal cells, so like the cells in our brain and nervous system, and our heart cells actually have a door that let NAD in.
Okay.
So that means...
So you take an IV, it will get to your brain, it will get to your heart, but not the rest of your cells.
But not the rest of the cells. And that's really important because NAD is needed in every cell.
Got it.
So you're missing a lot of your body out by doing it that way. So this is when precursors came into the picture. Now a precursor is like the building block for NAD. So it's like one of the raw materials that our body uses that can access our cells, that can get in. And then inside our cells, we have pathways that basically take these building blocks, stick them together to form the large NAD molecule. And for anyone that's ever heard of NAD before, you will definitely have heard of precursors like NMN or NR or nicotinamide. So they're the sort of top 3 precursors that people talk about. Now, the idea behind these is that you will take a pill that'll be full of these raw materials. It'll go in your body, it'll go in your cells, and hopefully your cells will form NAD or use it to make NAD. But what's now being found is, unfortunately, the reason why NAD declines is that the pathway in our cells that takes this raw material and sticks it together to form the whole NAD molecule declines with age. So we have a key enzyme that does that process. And this is what goes down with age. So I often get people to think of the cell as a factory. So if you had this NAD producing factory and production had gone down and you were like, right, we're going to go inside and see what's going on. You went inside and you saw that all of the machines were broken because they were old and dropping to bits. You would not say, okay, we're going to fix this issue by ordering more raw material and ignore the fact that the machines aren't working. You'd be like, actually, we need to fix the machines.
Yes.
So this is what we decided to do. We decided to design a product that not only had the raw material in, so had the precursor, but actually had ingredients in there that would fix the machines, fix the factory, switch back on that NAD producing enzyme so that the cell could actually
formulate
again.
It. Yeah.
Because our cells are actually really good at making their own NAD. Lots of people don't realize that actually we don't need anything from our diet to produce NAD. Our cells normally just make and recycle it, and that goes round and round. But that's what declines with age. So the product we designed is slightly different to everything else out there in that it not only has the raw material, but it also fixes the root cause that is leading to the NAD decline in the first place.
That is fascinating. I love that. My thing is skin and skin aging. And I'm studying that in greater depth at the moment. And what we find as women go through the perimenopause is that they have, and as they're aging and with sun exposure, which sun exposure, we know premature aging in the skin, 90% of it is attributed to UV or chronic UV exposure. Even in this cloudy country, what people don't realize is that although the sun is kind of missing or on holiday most of the year, UVA does come through every single day, even if it's cloudy, even if it's rainy, even if it's snowing, and that will cause literal damage to the cellular level of the skin. We're talking keratinocytes, melanocytes, fibroblasts. And what we find is as we're aging and we become more insulin resistant, and people who are developing type 1 or type 2 diabetes, they end up having an increased expression of an enzyme called matrix metalloproteinases. And that specific enzyme, also known as MMP, breaks down collagen. So there's no point, if I have a patient who I know is biologically, not in a good place, and they've got huge amounts of inflammation and their gene expression is not great, and they're sitting under a sunbed and they're not wearing their SPF, and they're eating all the wrong foods in trying to do collagen stimulation, because I can help them, I can give them the raw material, so to speak, to make new collagen. But actually, if that enzyme is continuously activated and is continuously breaking down collagen, what is the point? So instead, I try and reduce inflammation. We do that in a number of different ways. One of them is lifestyle. One of them is using LED light therapy or low-level light therapy. We've introduced one called Emerald Laser into the clinic, which I know you're speaking for them as well, Arconia. And now there are 22 FDA approvals that have shown that low-level light laser therapy has incredible abilities to stimulate ATP, to stimulate your mitochondrial function, and to reduce the inflammation. And that essentially helps us with the repair process. So it's not just one thing that we do. It's not just giving them a medication, but actually making sure holistically everything else is working in order in that factory to make what they need to make. So I love how you've explained that. So is it the same with the injections then?
Yeah, so the injections are kind of a similar issue to the IVs, in that we're still, first of all, we're not sure that it gets into the cells. And secondly, even if it does get into the cells, then you still haven't fixed the issue in the factory.
Yeah.
Because NAD, once it's been used once, it's actually broken back down into precursors. And then those precursors are supposed to be recycled back into fresh NAD. And that's the same pathway. So even if you do, let's say, get NAD in the cells, you still need to make sure that recycling process and those machines are actually functioning correctly.
Yes. I mean, I've been on Nishido for a little while now. And it's 6 capsules in the morning. Why didn't you make one huge capsule? That's just too much to swallow then.
It would be like the size of a gobstopper. And I think actually that's a really important point. A lot of people do go, 6 capsules, that's a lot.
Yeah.
But when we were developing the supplement, my background, my PhD was actually in bioavailability.
Yes.
So of nutrients and drugs. So how do they get through the gut into the cells where they need to be? So I was very passionate about making sure that we were basically using firstly the right types of raw materials that are protected through the gut, but also at the right levels, so that by the time you've accounted for absorption in the gut, metabolism by the liver, getting them through the blood to the cells where they need to go, that you actually have enough of the active ingredient left to perform its function by the time it gets in the cells. So when we were formulating, it was like, that is how much raw material is needed, and that is what works, therefore that is what is going in the product. And unfortunately, a lot of supplements, you have to be careful in that they'll say take 1 or 2 pills a day. But if you look at any studies that have been done on them, often the dose in the study is way higher. So this is a common thing with one of the other precursors, NR, a precursor to NAD. It's recommended on the back of tubs, the supplement tub, to take 300 milligrams, but actually you look at the clinical trials, they were done on 1,000 milligrams. So actually you end up taking a lot more if you actually want to get
and also what you absorb, right? Because we know that also in tablet form, when we are taking supplements, bioavailability is very important, delivery system is very important. Even with skincare, not all retinols are made equal. For example, you can have encapsulated or non-encapsulated. At what pH? Because the pH is going to change the absorption. Collagen supplements, are all collagen supplements the same? Hell no. And people don't understand that. So they'll often come to me and say, listen, I'm taking this liquid collagen that I take every day, which is very highly bioavailable, 90% bioavailability, which means I absorb the majority of it, as compared to a collagen supplement from Boots that is maybe half the price, but 1/10 of the dosage. And we know that in a tablet form, you only absorb 20 or 30%, which means you excrete the other 70%. So that's just expensive pee. Yeah. So what's the point, right?
Yeah, exactly. And I think, when you're talking about collagen, a question that I get asked a lot is, okay, so how does taking an NAD supplement compare to taking a collagen supplement? Because everyone, you know, when they're thinking about skin health, is very familiar with collagen. We know that collagen is in our skin, it's making up the structure of our skin, and it declines with age, and that leads to wrinkles and things like that. So we know that. So the idea of taking a collagen supplement basically means that you know collagen's declined, so you're going to drink some and hope that it gets to where it needs to be in the skin. But as you rightly identified, it's pointless if your skin cells are not in good health. If you have inflammation, which is actually degrading the collagen, then it's just pointless. NAD, on the other hand, restores the health of the cells. So it restores the health of the fibroblasts, which are the specific cells in your skin that actually make all your collagen and do a very good job at it while you're young. So if you can increase NAD levels, you can increase the function of those fibroblasts and actually stimulate your skin to start producing its own collagen. So you don't need to take it. You are actually producing it yourself in the right place where it's meant to be. And also NAD is known to reduce inflammation. So we know that it reduces inflammation in the skin, which means that you've got less of that matrix metalloprotease, that MMP, that degrades collagen. So, you know, whilst you can take collagen, actually, if you could just switch back on your body's own natural collagen production with something like NAD, it's going to have a much better effect than swallowing something and hoping for the best.
So that's really interesting, and I agree with you. I think with I always say actually to my patients, and they always say to me, well, what supplements should I take? Supplements are very important, but they don't preclude or come before other important things like getting your diet right. Getting your lifestyle right. And then even when it comes to things, you know, I do a lot of injectables. I also do stimulation of collagen in other ways. So if a patient has a budget, for example, what I would want to do is switch on their collagen making cells before I start to do something like microneedling radiofrequency. So microneedling radiofrequency is a treatment that will create damage to the skin and put it under stress, so to speak. But when we put that skin under stress, what we are doing is stimulating the wound healing response, which means in turn you're going to get better collagen production. You're going to get an improved collagen density in the area. But if your collagen making cells are not working in your favor, you're not going to do that. So first and foremost, I like to treat them with a regenerative treatment, like for example Sculptra, which is a polylactic acid. And if I can bring new blood vessels to the area, so I'm recruiting new blood vessels, I'm creating something called angiogenesis, creating collagen synthesis, and you've got recruitment of all these new fibroblasts, then I put them under stress. So I first made them healthier, then I put them under stress. That makes sense. So the sequence in which we do things is important. And for me, although I take a collagen supplement, I always say to my patients, this is an adjunct. This is not where you start. This is kind of your adjunct where you end. And the sequence in which you do things is important. So if you've got the spare cash, absolutely invest in the right one. But when I'm taking collagen, I don't just take collagen. I take a supplement that has 6 different things in it, including MSM, which is an organic sulfur to reduce inflammation. Because we know inflammation results in aging. So we call that inflammaging. And in the skin, if I see acne, if I see pigmentation, if I see rosacea, any erythema, first thing I want to do is take that inflammation down, because there is no point me putting a retinol on there when actually they've got all this inflammation which is going to break down any new collagen I make. First, I want to get rid of that inflammation. So it's understanding the systematic process and way in which we will clinically treat the patient to get the best outcome, rather than just throwing whatever is available at them. That doesn't actually work. It's getting the factory working first. So I love the way that you explain that. And then with, for example, my collagen supplement that I'm taking, it's got collagen, it's got MSM, it's got L-lysine, which is amino acid. It's got omega-3, which is very important, again, at reducing inflammation, because it's really easy to get omega-6s, but not really that easy to get omega-3, which we know helps in terms of that inflammatory and pro-inflammatory process. If we have more omega-3, we will reduce the amount of inflammation in our body. And you can get that from fish or oily fish, but not enough people are eating oily fish. And then the collagen, to me, is the last thing in there, because actually when we're eating collagen, we're not absorbing it. What we are doing is peeing it out. But our body recognizes collagen loss and starts to say, oh my goodness, I'm losing collagen, let me make new collagen to repair. But it cannot make new collagen without vitamin C. And if all you ever take is 100% of your recommended daily allowance of vitamin C, you can't make new collagen. You will only just maintain the collagen you have. So the process of making collagen actually requires 450% of your recommended daily allowance of vitamin C. So it's things like that. People are really stuck on their RDAs, not understanding what your recommended daily allowance actually means and which precursors, so to speak, you need in order to turn on all the right processes. So yeah, I think that's, you've explained it really well.
And I think it's really, for me, it's really exciting to see the progression of regenerative aesthetics in the space. Because obviously for a long time it has traditionally been, let's just treat things at the surface level. And as you said, it's been doing procedures that are stimulating damage in the cells. The microneedle and the lasers, they're designed to be, having a level of irritation and damage to trigger pathways in our cells that are then going to switch on, heal and repair collagen production. But if your cells are not in good health, you're stressing cells.
Exactly.
And that's not great. So I think the recognition now, and that a lot of practitioners are really starting to think about the order of the treatments, as you said you do in your clinic, and looking at actually protecting cellular health. Because as we get older, the regenerative capacity of our cells declines, and all of these procedures are dependent on the regenerative capacity of our cells. And as we get older, and as indeed the whole population becomes older, the regenerative capacity is only going to go down, which means that we don't get the healing and repair that we want to. We get longer down times, and also just not the patient outcomes that people used to have when they're younger. So it becomes an increasing priority to make sure that our patients' cellular health is really, really spot on before we start putting needles in, before we start doing anything that's going to be irritable or damaging. So yeah, things like supplements, a lot of the pathways that are stimulated in a lot of these treatments are dependent on NAD. So making sure your cells have adequate NAD to begin with. Things like polynucleotides that are, something that is priming the cells ready to be responsive to the other treatments that are coming. All of these things are about making sure our cells are ready, and you get the best treatment for your money, basically.
Absolutely. I couldn't agree more.
It's preparing the canvas.
It's fertilizer in a way, isn't it? You're fertilizing your skin. I agree with you. And of course, all of these supplements that we've talked about, although I talked a lot about women, are for men and women. I have got a few tubs at home, and I'm like trying to force my husband to take them in the morning. But it's important. It's important for both men and women. And I think also we need to empower men to look after themselves a little bit better as well. So I'm just going to finish off now by asking you, are there any other supplements that you take?
Yes. So the ones that I take, so first of all, I take some that are personal to myself.
Yes.
So I think supplements...
That's an important point as well.
Yes, are always a very personal thing. The top question I get asked is, what supplements do I take? So some of the supplements that I take are based on my blood work and my genetics. So a key example of this is that if I do my blood testing, I'm always extremely low in folate. When I have my genetics tested, I have the MTHFR mutation. And basically what this means is I've got a mutation in one of my genes that encodes an enzyme that takes folic acid, which is in pretty much all of our foods, and turns it into the active form, which is folate in our body. Folate's very important for things like epigenetics, DNA repair, things like that. And my enzyme just doesn't work. So I can be eating all the folic acid or taking folic acid supplements like we're told to, but my body will never convert it into folate. So I take the active form, which is folate, so it's slightly more expensive. But when I do that, my folate in my blood goes to normal levels. If I don't do it, it's really through the floor, and that's not good. So first of all, it's personalization. Other things that are more general, NAD, obviously I take Nichido Time Plus to boost my NAD levels. We know that NAD declines in everyone, so it's not something that some people are deficient in and some people aren't. It declines in everyone as they get older. Different lifestyle factors will make NAD decline quicker. Things that are, anything that's damaging our body, so an inflammatory diet, smoking, drinking, sunburn, all of those things will deplete it quicker than they should. So an NAD supplement. I also like a molecule called spermidine. Now, spermidine is an autophagy activator. So autophagy is this recycling process in our cells. So if we're to look at older cells compared to young cells, you'll see they get an accumulation of like cellular junk, shall we say. And autophagy gets rid of this junk, and spermidine is a molecule that's been shown to actually switch it back on. Another one that I like is...
doesn't come from sperm though.
Well, it's a polyamine that was actually originally isolated in some mammalian samples, shall we say.
Well, there you go. So
yes.
It's not just fish. It's not just polynucleotides coming from fish.
No, that's the polynucleotides coming from salmon.
Yeah.
Yes. But yeah, the name spermidine would suggest otherwise. So that's a really exciting one. That is something many people haven't heard of, but is a really good one. And there's something called Glynac. I don't know if that's something you've come across, but it's a mixture of glycine, which is an amino acid, and it's something called N-acetylcysteine, which is a precursor to glutathione. And using a combination of these two supplements has been shown to actually help reverse a lot of cellular damage and reduce biological age. So that's a couple of ones that I keep an eye on.
Amazing. Yes. Thank you so much. I feel like there's going to be a part 2 because there's so much to talk about with you. But we've got to go to our women's wellness event today. So thank you for coming on. And we will put down all of the supplements into the information on the podcast. So if anybody wants it, they can get it. We also have a discount code. So we'll put the discount code on there for patients who want to get it. Thanks a lot, Nichola.
Thank you so much.